I've spent over 2 decades of my life inside hospitals. I've worn the white coat, held the clipboard, and delivered the news that changes everything in a single breath. And I'm here today to tell you that one of the most dangerous places you can be isn't in a car or on a construction site. It's in a doctor's office, completely healthy, about to agree to a test you don't need. I'm about to say something that will make a lot of my colleagues angry. It's a truth I've watched get buried under layers of protocol, liability, and well-intentioned but deeply flawed logic. The idea that more information is always better, that catching everything is the key to a long life, might be the single most destructive myth in modern medicine. And after the age of 60, it's a myth that can absolutely destroy your quality of life. Let's start with a story. This happens every single day in clinics across the country, but I'll make it personal. A man, let's call him Richard. He's 67, retired, feeling great. He walks 3 miles a day, gardens on the weekends, and is looking forward to a long, active retirement. He goes in for a routine checkup, and his doctor, following a checklist, suggests a full-body CT scan, just to be safe. Richard feels fine. He's healthy. But he thinks, why not? It's the proactive thing to do. So he goes in, lies in a machine for 30 minutes, and walks out with the same spring in his step he had when he arrived. But a few days later, his life changes. The phone rings. The nurse says, "Mr. Richard, we have a finding. There's a small nodule on your lung. It's probably nothing, but we need to monitor it." That phrase, "probably nothing," is the most expensive and terrifying combination of words in the English language. From that moment on, Richard's mind is no longer his own. Every deep breath feels like a test. A slight wheeze feels like a death sentence. He spends 3 months in a fog of anxiety, only to be told he needs a follow-up scan. The nodule is still there. Maybe it's a tiny bit bigger. They can't be sure. So, to be safe, they recommend a biopsy. Now, a biopsy isn't a simple blood test. It's a needle being driven into his lung. It involves anesthesia, a collapsed lung risk, and the very real possibility of a life-threatening infection. The procedure goes well. The results come back. It's benign. It was nothing. It was always nothing. It was just a wrinkle on the inside, a part of the natural scenery of a body that has existed for nearly 7 decades. But Richard isn't the same person. He's lost 6 months of his life to crippling fear. He suffered a minor infection at the biopsy site that left him bedridden for a week. He's traumatized. He's objectively worse off than when he walked into that clinic for a routine checkup. This is the Cascade Effect in action, and it's the invisible engine that drives so much of what's wrong with our healthcare system. It begins with a test you didn't need, which triggers another you didn't want, which leads to a procedure you didn't require, which results in a complication you didn't deserve. It's a conveyor belt of risk, and once you step on, it's incredibly hard to step off. You see, modern medicine has a terrible problem. It doesn't know how to ignore a finding, even if that finding is meaningless. Even if it's a benign cyst that's been sitting peacefully in your kidney for a decade. The doctor sees it, and because they're human, because they fear missing something, they feel compelled to act. The system is designed to find problems, not to determine if they're actually problems worth solving. So why does this happen? It's driven by a beautiful lie. The idea of catching everything. This leads to the first and perhaps most seductive trap, the full-body scan. We're sold on the idea of complete control. The advertisements tell you it's the ultimate act of self-care. But here's the research. When you scanned 100 perfectly healthy people over the age of 60, roughly 95 of them will have an incidental finding. A spot on a kidney, a shadow on the liver, a nodule in the lung. 95 people will leave the scan feeling like they're walking around with a ticking time bomb. And the most devastating finding? Those who get these scans don't live a single day longer than those who don't. They don't have fewer heart attacks. They don't avoid cancer. They just have more anxiety, more depression, and undergo more unnecessary procedures. The scan didn't make them healthier. It made them sicker.
Instead, look at what the body can actually do. That's the real test of health. Can you climb 2 flights of stairs without gasping? Can you get up off the floor after playing with your grandkids? Is your balance steady? How is your sleep? Your daily life is the most powerful diagnostic tool we have. A conversation with a physician who spends an hour talking about your diet, your social connections, and the actual side effects of your medications will do infinitely more for your longevity than a 30-minute scan that turns up a mountain of harmless noise. The same principle applies to one of the most terrifying fears we have: losing our minds. Test number 2 is the brain MRI for routine forgetfulness. This is a ticking time bomb of psychological damage. Imagine the scenario. You're 74. You walk into a room and forget why you're there. You can't remember the name of a famous actor, normal age-related cognitive slowing. But your children are scared. They've seen the videos about Alzheimer's. They push you to see a neurologist who orders an MRI. You lie there, the machine clanking away, and you wait for the results. The results come back. The report uses terrifying language: mild cerebral atrophy, white matter lesions, small vessel disease. These terms sound like a progressive, unstoppable demolition of who you are. They sound like you're suffering from a neurological catastrophe. But what the report fails to explain is that these findings are about as normal for a 74-year-old brain as wrinkles are for a 74-year-old face. They are the texture of age.
Over 90% of healthy people over 75 will have findings that appear abnormal on their MRI reports. Yet the vast majority have perfectly normal memory and cognition. The image is a lie. It's a photo, and photos don't show you how the mind actually works. I've seen patients who can solve complex math problems have scary MRIs. And I've seen patients with very early dementia have scans that look pristine. The image simply doesn't tell you what you need to know. If you or a loved one is genuinely worried about memory, there are better ways. A simple cognitive test in an office takes 10 minutes. Ask the patient to recall 3 words. Draw a clock face. Count backwards. It's a test of function, not appearance. And if that test flags a potential issue, you don't go straight to a scan. You look for the real culprits. Is it a vitamin B12 deficiency? It's incredibly common in older adults, and symptoms are virtually identical to dementia. Is it a thyroid problem? Is it one of the dozens of common medications that can cloud your mind? Is it sleep apnea, quietly choking your brain of oxygen every single night? You'd be astonished how often correcting one of these simple things restores someone's memory completely. No scary images, no panic. Just targeted, effective treatment. We treat the person, not the picture. Then there's the routine stress test, test number 3.
The logic appears airtight. You're over 70 and you're going in for a minor surgery like a knee replacement. The hospital has a protocol. Everyone over 65 needs a cardiac stress test. It's meant to prevent a heart attack on the table. But stop and think for a moment. If you already walk a mile every day without chest pain or getting winded, what exactly is a treadmill test going to tell you that we don't already know? Your daily life is your stress test, and you're passing it every single day.
But protocol overrides common sense. They strap you to a treadmill and start pushing you. Here's the problem. Stress tests have a notoriously high false positive rate in older adults. The machine says your heart looks like it's struggling, but it's just struggling to adapt to the treadmill, not a dangerous blockage. It's a false alarm. But once you have that abnormal test, you get put on the conveyor belt. Next stop, a cardiac catheterization, a highly invasive procedure where they thread a tube through your groin all the way to your heart. It carries a real risk of stroke, heart attack, and damage to the arteries.
And what do they usually find?
The heart of a 72-year-old. It's got some plaque, some narrowing. It's not an emergency. It doesn't need a stent. It's just 72. But the damage is done. Now you are a cardiac patient for life. You're put on multiple new medications. You're terrified to exercise. You stop playing tennis. The test designed to protect you has just dismantled your confidence and robbed you of the activities that gave your life meaning.
Instead, listen to your body. That's the real test. If you can climb stairs and do your daily activities without chest pain or shortness of breath, your heart is telling you it's fine. If you want a genuinely useful, non-invasive test, get a coronary calcium score. It's a 5-minute CT scan that gives you a single number. A 0 means your risk of a heart attack in the next decade is extremely low. A high score means you need to be aggressive about prevention, diet, exercise, and maybe medication. It gives you actionable intelligence without forcing you onto the conveyor belt of invasive procedures. And finally, we come to the most controversial test of all. Test number 4. The routine colonoscopy after age 75. Let me be crystal clear. I am not against colonoscopies. They are a miracle of modern medicine. They save lives. If you are 50 or 60, get it done. Please. It's the best tool we have to prevent colon cancer by removing polyps before they become deadly. It's a no-brainer.
But medical interventions have a balance of risk and benefit. And that balance changes as we age. At 78, 80, or 82, the risk equation flips. The benefit of a colonoscopy is preventing a cancer that takes 5 to 10 years to develop. But what if your life expectancy is less than 10 years? What if you're 80 years old? The math becomes unforgiving. You're statistically more likely to be harmed by the procedure than to be saved by it. Why? First, the preparation is brutal. Drinking that industrial-strength laxative can leave an elderly person dangerously dehydrated and severely weak. Second, the sedation used carries a heightened risk of confusion and respiratory problems in older adults. And third, the risk that keeps doctors up at night: perforation. As we age, the wall of the colon thins. The chance that the scope accidentally tears a hole in the colon wall roughly doubles or triples after age 75. A perforation is a surgical emergency. It requires immediate, major surgery and frequently results in a colostomy bag. For an 80-year-old, that magnitude of intervention can mean the end of independent living forever. This is why major medical guidelines now recommend stopping routine screening between the ages of 75 and 85. If you're 80, you've had normal scopes in the past, and you have no family history, you are far more likely to be harmed by the test than helped by it. So what do? Protect your colon without the risk. If you notice any changes in your bowel habits, blood in your stool, or unexplained weight loss, see a doctor immediately. That's non-negotiable. But the most powerful prevention is nutrition. Increase your fiber intake dramatically. Eat lentils, broccoli, oatmeal, and beans. This nourishes your gut bacteria, which produce compounds that actively suppress inflammation and cancer development. It's real, meaningful, safe prevention that benefits your entire body. This is the pattern. Always the cascade. One test triggering another, leading to a procedure and ending in a complication. Somewhere along that chain, we lose sight of the only question that matters. Is this person actually better off? Health is not a perfect score on a test. Health is function. It's the ability to walk your dog, to travel, to laugh with your grandchildren, to read a good book. It's life lived with freedom, independence, and joy, free from the tyranny of unnecessary medical interference. I'm not telling you to abandon your doctor. I'm telling you to become a formidable, informed patient. When a test is recommended, ask why. Ask what happens if we find something. Ask what are the real risks. And ask, is there a better alternative? You are the steward of your own health, not the guidelines, not the computer reminders, not the insurance system. You. The most powerful thing you can do to protect your life might be to look a test in the face and say, no. Not because you're afraid of your health, but because you understand exactly what that test will cost you, and you've decided that your life is far more valuable than a test result.